Dr. Unnikrishnan, Senior Neurosurgeon in Lourdes Hospital. Today, 8th June, is being observed as the World Brain Tumor Day. This was started in 2000, the year 2000, by some German Brain Tumor Association as a voluntary gesture. What was the purpose? Purpose was to educate the general public about brain tumor and also to pay tribute to the people who are suffering from brain tumor. What is a tumor? A tumor is an abnormal growth in any part of the body. It can be a benign tumor or it can be cancer. Tumors do not spare the brain. It occurs in the brain also, benign or cancerous. And sometimes it spreads from other parts of the body. According to the National Health Portal, the incidence of brain tumor is increasing in India. This year, the theme of World Brain Tumor Day is Together We Are Stronger. So to create awareness, to detect brain tumor as early as possible and give timely treatment and see that the patients are adequately followed up. What causes the brain tumor? Nobody knows. The radiation might be a cause. Some people say that excessive use of cell phone can cause. We do not know. How do brain tumors manifest? What are the symptoms? Usually, the following are the symptoms, like changes in the higher mental functions, the memory, the thinking, the awareness of surroundings, etc. There may be headache, difficulty with vision, fits, epileptic fits, vomiting, difficulty in walking, difficulty with speech, difficulty with sensations in different parts of the body, etc. So what do you do when a patient comes with some such symptoms? The first thing to do is to take a detailed history from the patient. Make a thorough examination of the patient. And then, if a brain tumor is suspected, then we subject the patient to a magnetic resonance imaging or MRI or CT scan. Sometimes in addition to that, we have to do angiograms also to see the blood supply of the tumor. And having detected a brain tumor, what should we do? We have to prepare the patient, make him aware of the problems carefully, gently. It should not be a shock to him. And then the modalities of treatment are: one is operation, following the operation, radiation therapy, chemotherapy, and follow-up treatment with medications to prevent seizures, medications to prevent swelling, etc. Sometimes this causes fluid collections in the brain, in which case you may need to do an additional operation to divert that excess fluid into the abdominal cavity, what is called the ventriculoperitoneal shunt. Now, in all these fields, tremendous progresses have been made. Surgery, for example, it is now not necessary as before to make huge incisions on the scalp. With precise techniques like neuronavigation, we can locate the tumor with such precision that you need to make only a small cut over the scalp. We can also do keyhole surgery with the use of endoscope. You can operate on remove many brain tumors through the nose using endoscope. You can reach previously unreachable areas, parts inside the head, and remove tumor safely with these new techniques and instruments. Another thing is sometimes this tumor are so close to functionally very locant areas, meaning the area which controls your speech, the area which controls the movements of the hands and feet, the area which controls your vision, etc., etc. So, when you try to remove tumors from there, it is quite possible that you damage these areas, with the result that when the patient wakes up, there will be defects. So, what we do in order to avoid this, it is number one, to get a precise localization with neuronavigation. Plus, we can now operate with the patient fully awake. There is no pain, surgery and the brain is going on, patient is awake. So if it is near the speech center, you can talk to the patient, and if you find that there is alterations in the speech, you know that you are dangerously close to that area, so you can control your movements. So also, if it is the motor cortex, meaning the part which controls movements of your limbs, again you ask the patient to move the hands or legs or whatever and see if there are changes. So therefore, you can control your resection, you can be very precise. So such things are evolving, has already evolved, and it is the advances made are considerable, and these surgeries are becoming very, very safe now. Safe not only life preservation but function preservation. Then also the material, the tissue that you get can be subjected to special tests like histopathology, then immunohistochemistry studies, which will tell you precisely what kind of a cell that tumor has and which treatment is going to be the most effective. So you can choose the drugs. Radiation therapy, again, so much of advances have taken place. Now we have stereotactic radiation, gamma knife. Again, using these techniques, you can precisely deliver the dose of radiation required for that tumor precisely within the tumor, without destroying, without affecting the surrounding normal brain. So such things are there. So what you need to do is that at the earliest sign, the earliest symptom, approach the doctor. Any disease, if it is detected at the earliest and the treatment is given at the earliest, the results are good. So that is the important thing. Let us detect the lesion early, for that you should present to the doctor at the earliest. Don't keep waiting to see what is going to happen. And having said all these things, I really honestly hope and pray that none of you get brain tumor. And also, those who have it, let them get early treatment, successful treatment, and wish you all the best. Thank you.